Good morning, everybody. Thanks for joining us today. It's my pleasure to welcome you to today's MHF Top 10 webinar, Top 10 Insights on Supporting Evidence-Informed Policymaking in Nigeria with a focus on evidence ecosystem maps.
Hi, everyone. Good to be at the presentation. As you must have heard, I'm Jesse Uneke, and I'm going to be sharing with you some of the insights to the work we are doing in Nigeria, which we have used to bridge the gap between research and policy, and between researchers and policymakers. I'll be sharing with you the top 10 insights from our experience, and hoping that you'll be able to draw some vital lessons that can help your work in your own country. As a way of introduction, we know that most low and middle income countries, the health outcomes have remained unacceptably low. And we have come to realize that at the center of this human crisis is the failure of the health systems. And this is attributed to lack of adequate capacity with the policymakers, those who are saddled with the responsibility of making policies in our own countries. And one of the major capacity constraints is the lack of ability to use research evidence in policy making. And so here we have developed some models, some frameworks, and some strategies to enhance the capacity of policymakers to be able to make policies that are informed by evidence. So I'll be sharing with you the top 10 strategies or insights that have helped us in our work here in Nigeria. The first thing we did was to assess the policymakers' capacity constraints in evidence-informed policy making. Now, we didn't want to assume that we knew the problems that they had or their capacity constraints. So we designed interaction meetings with them. We had a consultation meetings with senior policymakers in the health ministry and other organs of the government involved in policy making. And there were three fundamental questions that the policymakers answered that provided us a guide as to what we need to do to enhance their capacities. So we asked them what their specific capacity constraints were in evidence use in policy making. And then we also found out the areas they are having challenges with their capacity in the use of evidence in policy making. And then, of course, we needed to know what their specific expectations were from the researchers like us, so that whatever we did will specifically address their needs. So after we had identified those capacity constraints, we now initiated the process of building robust formal and informal relationships with the policymakers. And then, of course, to enhance the capacity of researchers to be able to engage the policymakers effectively. Now, the essence of building the formal and informal relationship was to address mutual mistrust, to develop friendship and cordial working relationship, to sign MOU for partnership, and then, of course, participate in each other's programs. The essence of that was to look at each other as partners in progress rather than rivals. And that worked effectively. We had meetings with the Commissioner for Health, as you can see here, and then in figure 3. And then we also conducted some capacity development workshops for the researchers, so that they could learn how to produce and provide evidence in formats that are acceptable to policymakers, like policy briefs, and then also learn how to organize policy dialogues with policymakers participating. And then, very importantly, to engage policymakers in the design of research works. We never had this before, where policymakers participated in the design of research. For the first time, we had that happening. And then we discovered that the policymakers were quite interested in this, unlike what we thought before we commenced the project. For the insight number 3, we initiated a number of models, and the first model we initiated to bridge the gap between policymakers and researchers, and then to enhance the capacity of policymakers for evidence-informed policymaking was the mentorship model. Now, under the mentorship model, we had 4 to 7 policymakers coming under a professor in the university as their mentor. And the essence of that was to build research capacity for the policymakers, to build leadership capacity, and then also to build sustainable capacity, all within the framework of evidence-informed policymaking. We defined and prioritized health problems systematically, and we taught them how to do that, how to develop and scientifically evaluate appropriate solutions for policy, and then, of course, to apply the knowledge generated through research into policy making process. And then, of course, we also enhance their capacity for strategic planning, knowledge management, partnership building, monitoring and evaluation, and then, of course, to be able to make use of local available evidence for policy making. And then we also guided them in ICT training workshop, where we taught them how to search for evidence and how to authenticate evidence, how to assess evidence for use. And then prior to that time, many of the policymakers didn't even know the databases to go to look for evidence. So we had to guide them on that, and then how to assess how much evidence is valid for them to use it in the policy making process. Then we looked at the second, we initiated a second model, which is the Health Policy Advisory Committee. Now, under this model, we had senior researchers and senior policymakers forming a committee to advise the government on how to use evidence in policy making. Essentially, the Health Policy Advisory Committee is a stakeholder coordination mechanism that provides a forum for information and experience sharing, and it was a very good platform, because for the first time, policymakers and researchers could sit down together and share experiences, share information, which helped the evidence to policy process in the state. Some of the functions of the advisory committee is to offer evidence-informed advice, to provide evidence-informed options and guidance, facilitate development of policy brief, and then, of course, to serve as a bridge between policymakers and researchers. So we had some capacity enhancement workshop for the committee, which helped the committee to be very effective in its work of advising the government on evidence-informed policy-making process. And then for the insight number 5, that was our third model, which is a secondment model between the university and the Ministry of Health. Here, under this model, we had about 10 senior researchers coming into the Ministry of Health as secondees. And then we had the same number of senior policymakers coming into the university to also serve as secondees. The essence of this was to let each party to understand what obtains in each other's institution or organization, and see how they can work together. So for the researchers secondees, the activities at the Ministry of Health was to build trust and gain understanding of policymakers' evidence need. They played expert advisory role and provided scientific evidence to guide policy issues, and then, of course, provided capacity enhancement for policymakers to acquire, assess, adapt, and apply research evidence. I am among those who went to the Ministry of Health and as a secondee and provided that capacity building for the policymakers, and also gained understanding of their needs, especially evidence needs. Then we had the policymakers who were in the university as secondees. They worked with research group as team members. For the first time, we had we had people who are policymakers serving as members of research teams and provided the research teams policy perspective to their research. We also had the policymakers participating as course facilitators in the university training program, and then served in the university research ethics committee. Here we had the picture of the policymakers and researchers coming together. The secondees had time to interact among themselves, understood each other better, each other's needs, each other's weaknesses, and see how a lot of mutual mistrust could be addressed. And it was fun because both parties enjoyed working with each other. Here we had a director in the ministry facilitating one of the training sessions in the university. And then here, these are the members of the Health Policy Advisory Committee, and we had 3 policymakers amongst them. And here, the policymakers contributed in guiding the research work submitted to the committee to also have a policy perspective to it. And it has helped a lot of research going on in the university to now have policy perspective or policy trust in the research that we are conducting currently in the university. Then the insight number 6, we initiated a lot of policymakers and researchers meetings, especially for policy dialogue. Recently, we had a national policy document on the use of insecticide-treated nets for the control of malaria. The national document is a generic document. So we had to produce a policy brief that contextualized the generic document into the context of the state. And then we had policymakers and researchers coming together in the Ministry of Health to for a policy dialogue on that document. And then we were able to come up with recommendations that were specifically within the context of the state. And then the platform has continued, and then we meet from time to time to look at policy issues under a stakeholder, multi-stakeholder policy dialogue. Then in an effort to institutionalize the capacity development we had introduced, we initiated the establishment of the first African Institute for Health Policy and Health Systems in the university, and also the Policy Information Platform, which we were supported by the Alliance for Health Policy and Systems Research to start the first one in Africa, the Policy Information Platform. Here we commenced the training of policymakers, researchers, members of civil society organizations, and then every other person that is qualified and then interested in health policy and health systems. So we have short-term certificate course program, and then of course degree awarding programs there now that we have commenced. And then the Policy Information Platform Nigeria is a one-stop shop or repository for strengthening access and utilization of research evidence in policy making. You could visit that. The website is there. Here we assembled all the available Nigerian health policy documents. So this is the only site at the moment where you could access all the available Nigerian health policy documents. We also have policy briefs, evaluation reports, and then some scientific research done, which people can also access. We are still developing the policy information platform and expanding it so that it will really serve as a one-stop shop for meeting the evidence need of those who are making policy and as well as those who are doing research in that. Then insight number 8, after we concluded the 3 models, the mentorship model, the head policy advisory committee model, and then the secondment model, there was a unanimous agreement among the researchers and policymakers for us to have a permanent platform where we can meet as researchers and policymakers together outside the university and outside the Ministry of Health, so that we can continue to promote the evidence to policy process. So the Society for Health Policy Research and Knowledge Translation was established. We had the backing of the federal government of Nigeria that approved the establishment. And then our mission is to promote multidisciplinary and intersectoral approaches that are evidence-informed in addressing societal health and developmental challenges. So we are currently working towards having our first international conference where we can bring policymakers and researchers together to consider issues of research and policy interface and see how we can promote cordial working relationship between the 2 parties. And following the work we are doing, we also identified that beyond the policymakers, there are other key policy actors that we also discovered are very, very vital in evidence use in policy making. And these are the parliamentarians, the uniform services, and then recently we also discovered a new category of policymakers, which we call the civil sector policymakers. These include the faith-based organization leaders, religious leaders, and then traditional leaders. In Nigeria, the traditional leaders are very, very powerful set of leaders because they can determine to a large extent what happens in their domains, in their states, in their communities. So we felt that involving them also as key stakeholders and policy actors will help to promote evidence-informed policy making. And so we engage them, and here, just early this year, I took my team to the parliament, the state parliament, and then we met the elected policy makers, elected parliamentarians, and taught them how to use evidence in legislation. So it was evidence-informed legislation capacity enhancement program. And to our amazement, they were so happy and bought into the idea, and some of them are making plans to come and enroll into the program in the university to enhance their capacities further. They confessed to us that they needed the capacity to use evidence in policy legislation. And so we provided them with that capacity, and we are still working with them to see how we can have better legislation in Nigeria backed by evidence. And then, of course, the uniform services seem to be a group that have been left behind. People don't want to work with them, but we also saw that they are very, very critical policy actors, and then we need to also engage them. So the Nigerian Army, the Nigerian Police, the Civil Defense Corps, so we got them involved, and then also promote the evidence-informed policy making and practice among them, because they also have a very robust health service delivery sector in the uniform services. Then, just to round off, we look at the ecosystem landscape map for the health sector in Nigeria. That's the insight number 10. And then here, we identified the research producers, the research translators, and the research users. In Nigeria, the research production is mainly done by the universities, and then of course we have some national research institutes Pharmaceutical Research Institute, Medical Research Institute, Veterinary Research Institute, and then of course our African Institute for Health Policy and Health Systems, and then others. So mainly these organs produce research, and then we have the research translators, mostly the professional organizations. And then we have those that make use of research, principally teaching hospitals, development partners, parliament, and then of course the federal and state ministries of health. Here there are gaps that exist between these organizations, and then between within the ecosystem evidence process, including poor funding, especially in health policy and health systems projects. There is poor funding in that, but we are trying to see how we can sensitize the government to show more interest in funding health policy and health systems projects. There is also the policy research disconnect. It's only recently that research evidence is now being sought in the policy making process. And then of course we still lack individuals with high capacity in knowledge translation. Of course, we are hoping that with time, after building, since we now have an institute that will develop that capacity for those that need them. So we are hoping that with time, we will have more and more people having the capacity to do knowledge translation. There are bottlenecks, of course, which I'm going to explain in the next slide, between these organizations, and then also in the ecosystem landscape map generally. But we are hoping that with the effort we have started making, that with time we'll be able to get enough capacity so that people can now do the knowledge translation better. Now, if you look at this as an example of the Nigeria health sector evidence ecosystem landscape, now you have the research producers, the research translators, and then the research users. Here, of course, we have the universities, like I've explained, and then other research institutes. Most of the funding comes from the government, and then, of course, international funders at the moment in Nigeria for the universities. Here, we still have the poor funding, and then research to policy disconnect and lack of KT skill as a major challenge here. But then here we also have the lack of policymakers researchers platform. We just initiated the first platform where in Nigeria, where you have policymakers and researchers coming together as members. And then we are hoping that more of these platforms we emerge in the coming years, so that we will be able to bridge the gap properly between those who are in the position to generate evidence and those who are in the position to make use of evidence. And then here, where we have the research translators, we have a major problem here, a major challenge. We have the Nigerian Medical Association, the National Association for Nigerian Nurses and Midwives, and then the Pharmaceutical Association of Nigeria. The problem with this is that we still have organizational silos. Here in Nigeria, there is still the problem of interdisciplinary rivalry, and then, of course, battle for supremacy. It's affecting a lot of effort that is made in knowledge translation. And then we are hoping that with the emergence of a society like the Society for Health Policy Research and Knowledge Translation, where we have people from NMA, from PSN, from SOGOM, the Society for Gynecologists and Obstetrics of Nigeria. So we are having all these individuals from these monodisciplinary groups now coming together to interact, and we are hoping that it will reduce the organizational silos, and then also reduce the friction between the operation of each of these groups. That's what we are hoping that we achieve. And then one very important research translation is the media, and we have started engaging them effectively because when we talk about policy dissemination, media is very, very important, and then we are making a lot of efforts to see that we get the media, both electronic and print media, involved in our knowledge translation efforts, so that we can have policies made available to the larger sector of the population in the language that they best understand. Well, as we try to move research evidence today from the research translators to research users, there are some problems that we are also currently having, and that have to do with interferences. We still have the political, cultural, and government bureaucratic interferences, as well as the need to be able to tailor policies to be consistent with the values, with the norms, and the tradition and culture of the people. Nigeria is a very, very vast and complex society where we have more than 200 ethnic groups, and then most times Nigeria is divided along religious, cultural, and traditional lines. So if you must do effective policy, you also need to consider the policy within the framework of these critical factors in Nigeria. For instance, if you go to the northern Nigeria, there are certain policies that cannot work there if you don't bring it into the domain of the religion of the people. Otherwise, it may suffer a lot of failure. The same thing in the south. So we have also come to learn how to tailor policies to be able to fall within the framework of the values of the people, their norms, and then their tradition, because it works better when people see health policies that are made within the context of what is acceptable to them or what they practice. For instance, in northern Nigeria, there is high level of maternal and infant mortality, especially maternal mortality. It has been suggested that one of the ways to address this is by having more doctors who are specialists in obstetrics and gynecology. But then it must also be added that they should be mainly females, because traditionally the average core northerner will not allow anybody that is not a female to attend to his pregnant wife. So these are some of the issues that we had to contend with in Nigeria, and that's why we are now trying to see how we can also address the evidence to policy process so that it will accommodate the norms and the values of the people. In conclusion, we are looking at the types of interventions and the support that the ecosystem landscape map, the health sector, benefit from in Nigeria. One of it is to increase funding and investment into evidence to policy research. And then we need more platforms where policymakers and researchers can interact, either formal or informal. But by all means, we need to continue to have policymakers and researchers coming together to interact. And so we are encouraging policymakers to invite researchers to their programs, and then also encourage researchers to invite policymakers in their own programs. We've started that in my institution as a result of the relationship we had established with the Ministry of Health, and we are having a lot of interesting outcomes. And then policymakers should be involved in the planning and execution of research, and then also researchers should also be involved in the planning and execution of ministry programs. We see that when this is done, it will facilitate the evidence to policy process. And we are also looking forward to having government ministries and other government arms commissioning research, because there is a very high tendency that when they commission research, they can easily uptake the evidence generated from the research that they have commissioned. So we are working towards that. There is an arm of the government in Nigeria. It is called the Tertiary Education Trust Fund, that provides grants for research to tertiary institutions. What we are trying to do is to see how we can encourage that arm of the government to initiate research that are within what government ministries will require, so that when people are doing research in the universities, the research is done to target the needs and the requirements of government agencies and ministries. So with that, we are hoping that that will facilitate the uptake of research evidence generated in the universities by the arms of government. And then finally, we are also making efforts to promote staff exchange between research institutions and government ministries. We experimented on that for 6 months under the secondment model, and it was a wonderful, we had a very interesting outcome. We are hoping that with these results that we've been able to achieve in that more and more government agencies will partner with the universities, and then we can have secondment, robust secondment arrangement, so that researchers can work in ministries, and the ministries workers can also come into the research environment for some time, and then understand each other's need, understand how to work better with each other. We see that that can help go a long way in improving the evidence to policy link. So thank you very much for your attention. I want to hand over to Stephen.
Thanks very much, Jesse, for sharing those great insights and some really interesting examples of your work in Nigeria. Actually, what I'd like to do is just hand it off to John first, and then to Kaelan. They'll share some insights and thoughts from your presentation, and then we'll open it up for Q&A. John?
So Jesse, thank you very, very much. Two comments more about you, and then two questions for you. The comments, for those of you who don't know Jesse, two extraordinary skills. One as a finisher, and I'll explain that in a second, and the second as a boundary spanner. I have a colleague at McMaster who divides researchers into finishers, the folks that turn every research project into a high quality research publication in a peer-reviewed journal, and non-finishers, and of course most of the university environments are in the non-finisher category, and I put myself in that group. Jesse is the best finisher that I've ever encountered. Always turns his work into very robust peer-reviewed publications. And the other thing which I knew, but it really jumped out at me in this presentation, was how he works as a boundary spanner. So reaching out to people in the ministry and parliament, in civil sector organizations, in the media. It's quite an extraordinary array of boundaries that he is spanning, all in an effort to try to join people up with the goal of supporting better decision making informed by research evidence. So those were just two comments for those of you who are looking for someone to emulate as a finisher and or a boundary spanner. I'd highly recommend watching Jesse. My questions for Jesse, I have two of them. So Jesse, one of them, it has to do with the order of your 10 insights. As you were going through it, I wondered whether the order was in fact chronological, and if it was, what is the time frame over which you've gone through this progression, and to what extent has turnover of folks in government been a challenge for you? And the reason why I ask about the ordering is there were times where what I thought of as similar interventions, like mentoring, reciprocal secondments, they often didn't appear side by side, which made me feel that it was likely chronological. So can you, and I'll come back to my second question later, but can you just talk a little bit about whether the order is chronological? If so, what's the time frame for these experiences, and whether turnover has been a challenge for you? Because I think the time frame is a number of years in this case.
Yeah, thanks a lot, John, and thank you very much for the commendation. It's actually in chronological order, though there's some overlaps here and there, but the 10 insights insights appeared in a chronological order. This work has spanned over for close to 10 years now. We actually started in 2008, and this is our 10th year working on this. Some of the models are still operational. For instance, the Health Policy Advisory Committee was set up for the first time in 2011, and it's still on now. We also have the mentorship program. The mentorship program officially has ended, but we still have the policymakers still coming back to us, the professors in the university, to support them whenever they have some issues. So technically, the mentorship program is still on, because we also support the policymakers in the best way we can, so that they will be able to make use of the evidence we provide for them for policy making. And then for the secondment program, we did it for 6 months. That's because the funding we were provided for could only carry the secondment within that 6 months. That we have ended now, but then we were able to institutionalize that, because some of the members of the policymakers secondee are now with us in the university. I was in Liverpool with one of them. He's Henry. Is a policymaker. He has now been offered an adjunct position in the university, in the institute, as a facilitator of some of our programs. And then I am still supporting them in the Ministry of Health, capacity building, capacity enhancement, to chair some of their programs where they will require somebody with high level knowledge on evidence to policy process. And so it's still been on, but then there are some challenges that we have had in the past. One of it is the lack of sustainability of government initiatives, and then the instability in the government. Sometimes the permanent secretaries, the turnover of permanent secretaries is so high. I remember when we had our first major funding from 2009 to 2011, just within 2 years, we had 4 different permanent secretaries in the Ministry of Health. And so it was a lot of some frustration, because you need to start all over again with the new permanent secretary and all that. So, but we are having some stability now, much more than what we had before in the government arm. So these are some of the issues that we had to just had to handle in order for us to still move forward in our efforts to improve the evidence to policy.
Great, very helpful. Thank you. My other question, Jesse, and you started to get at it with your comments just there, it has to do with if you were starting now, would you still pursue a similar menu of activities if you had the funding to do all of them? So the mentorship, the secondments, the training courses, the policy information platform, the policy dialogues informed by the policy briefs, do they still strike you as the right mechanisms given now a decade of experience? And then a related question, unless I missed it, the only thing that wasn't there in mechanisms was rapid response or rapid syntheses. And I wondered if you could talk a little bit about whether that has just been related to a lack of funding support for that, or is it something about the context that has led you to think that it might not be as good a fit for Nigeria?
Yeah, thanks, John. Well, we have experimented on the model, the 10 insights, and we have discovered that within the context of Nigeria, and then I'm also certain that to a large extent, low and middle income countries, these models can work. They can work effectively. So if I had opportunity to initiate another effort to bridge the gap between evidence and policy, I would still be very happy to apply the models because we have had a lot of outcomes that are very, very favorable. In fact, we've had policymakers aggressively using evidence in the policy making and implementation as a result of exposing them to these models and then to the strategies that we have applied. So they have paid off a lot, and then I believe strongly that it can work in any low and middle income country with some modifications that will suit the context of that. And then, well, for the rapid response, we thought about it, but the main reason why we have not really implemented that is the lack of funding. We've not been able to receive any funding to investigate the viability of rapid response. But from what we have seen, the relationship we have built with the policymakers, even though we don't have a formal rapid response mechanism, but because we have built relationships with them, they still contact us and desire that we provide them with evidence that will help them in developing some policies and all that. I remember a few years ago, the Commissioner for Health called me one night and requested that I provide him with information on the prevalence of soil-transmitted helminth infections, because the wife of the governor was going to do a launch of a deworming exercise in the state, and they needed such information. And within 6 hours, I was able to provide that information for him, which was difficult for him to get any other place because they are local available research evidence. And so they still come to us, but I believe when we have a mechanism, a platform that is functional for rapid response, I believe we're going to have a lot of requests coming from the government arms, especially when they know that such services are available for them to access.
Excellent. Super. Thank you very much. Over to Kaelan.
Hi, everyone. And Jesse, thanks for sharing again. I always learn more each time I see you present on the work that you've been doing at Abonye. It's just amazing, as John already mentioned, how much you get done compared to the rest of us. So I'd just like to kind of take the time to just tell you my biggest reaction today was how interesting it is to see that some of the things we're discussing as the cutting edge or the next wave of knowledge translation efforts internationally, you're already moving in those spheres. So the first one that I think that you're excelling at, and we've discussed this in person before, is about sustaining your long-term efforts. So a lot of focus has been on institutionalization, building demand, and it's clear that you're exceptionally well positioned to kind of move forward over the short, medium, and long term, most importantly, through all of the work that you've done. So specifically setting up the African Institute for Health Policy and Health Systems, all of the relationships you've been building. It's amazing for me to see that it's not just the interactions, it's the mentoring, it's engaging civil society, parliamentarians, the secondment program was something that was new to me today that I hadn't spoken with you about. And again, just another example of how diverse your approach to building relationships, building demand, and ensuring that over the long term, your organization and the efforts in Ebonyi and likely across the country are going to be sustained, which is something a lot of people in the field are a little bit far behind on. And as you probably know, Jesse, and others on the line might know, that there's a lot of effort right now on understanding how to institutionalize support. So that for me was the biggest takeaway in terms of where you're really excelling on the cutting edge already. You're also kind of moving beyond health already, which was interesting for me to see, because in our discussions, I hadn't realized that you had started the Society for Health Policy Research in KT. And while health is in the name, it's clear to me that you're already thinking from an intersectoral lens about how to address pressing problems in Nigeria and in Ebonyi State, which is really interesting to me. So you're not only just figuring out how to sustain your long-term efforts, you're moving beyond health. You're also kind of thinking through how to collaborate with others who have value to add in the ecosystem rather than competing. So you've given us a really clear example of how you might approach an ecosystem map, identify who can do what and what value they're adding to the knowledge translation process, which was really, really interesting. I'll circle back to that in a second, because I do have one question for you regarding the collaboration and how you're kind of thinking through engaging others in the ecosystem. And the fourth one is, it's clear to me that you're also creating opportunities to learn from others. So I know that you've been long engaged with the EVIPNet group. You're now working with John and a number of other partners across Africa and internationally on a complementary project about how to adapt, pilot, and iteratively refine mechanisms that you discussed today outside of health. But also with your Health Policy Advisory Committee, it's clear that you're also doing a lot of stuff at the domestic level. So I thought, again, wow, it's amazing to see your group kind of already on the cutting edge of creating opportunities to learn from one another. So my one question, Jesse, is just that it would be good to know about how you're engaging others in your ecosystem. So you've done this, you've identified some major barriers after your ecosystem assessment, but it just, for me, would be very interesting to know whether or not you've engaged the data production groups, if they do exist, and how you've utilized them in your interventions in pushing forward support for evidence-informed policymaking is one example, but there may be others that I didn't pull out of the slide, but just how other groups in your ecosystem have been engaged in the efforts that your group has done.
Yeah, thanks a lot, Kaelan, for the commendations. Yes, well, we had our challenges. When you are coming up with anything new, you do a lot of work to get people to buy into the idea, to buy into the initiative. And so it didn't just come so easy. There were times we felt like giving up. There were times we felt that like forgetting about it, but then kept on pushing. And then along the line, we had some breakthroughs in the effort. Well, what we do is that we try to create opportunity or room for anyone that is interested in enhancing the evidence to policy process to participate in what we are doing. We are so broad-minded, and then we look at the evidence to policy process as where everyone, irrespective of your skill, irrespective of your discipline, you have a place, you have something to offer, you have something to add. And so what we do is that once we discover any group that we felt they have something to offer, we engage them. We into some dialogue, into some consultation. We visit them, we discuss with them, we present what we are doing, and then also invite them to participate. And then most importantly, we also learn from them. We don't approach the efforts or the initiative as if we knew everything about it. No. Once we see individuals who have something we believe can offer to what we are doing, we invite them and we create room to learn from them. We allow them to come in with what they have, and then we learn from them. So like you said, those in with skills in data analysis, data management, and then the other groups, we are also reached out to them, and then we are getting some positive response from them. One very important thing I have done within the university is that when I identify any individual within the university that I feel is interested and has the skill to offer a service to us in what we are doing, I invite the person to join. So now we have people coming from almost all the major areas of specialization involved in what we are doing at the institute. We have people coming from arts and social sciences. We have people coming from humanities. We have people coming from even physical sciences, industrial chemistry, and all that. So everybody is just looking at the evidence to policy process as where they can also come in and offer something that will improve the policy making process. So that's one of the our greatest strength, creating room for people to be able to participate and then also learn from it. So initially it was not, it was quite challenging, but now it's even easier for us now to get these people to come on board and be part of what we are doing.
Thanks.
Thanks, Jesse, and thanks, Kaelan and John, for some interesting questions and insights. We have a couple of questions from other people that have joined the webinar as well. So one of them was actually covered a lot of what you just talked about, Jesse, but they asked who the actor was, whether it was an NGO, university, health ministry, or researcher that kind of pushed you to establish this initiative, and who amongst the various actors was the most difficult to convince, and how did you go about convincing those who were reluctant to join in?
Thank you very much. Well, in Nigeria now, we have 4 categories of policymakers. We have the elected policymakers, we have the appointed policymakers, we have the career policymakers, and then lastly we have the civil sector policymakers. We have identified these categories of people. The elected are those who who came to power through ballot. The appointed are those that the elected policymakers appointed. But the most critical aspect, the critical category of policy actors are the career policymakers, because they have a lot of experience. They have outlived several governments, several elected and appointed policymakers come and go, and they still remain. So these are the category of policymakers that we are really focusing on, and then they have been the easiest for us to access. The most difficult category of policymakers are the elected policymakers. We're talking about the governors, talking about the chairman of local councils, they are elected. Then talking about the parliamentarians. So these are the most difficult set of people to reach, because it's not easy to access them. If you invite them for programs, they don't stay. They can just come for the opening ceremony and they go. So one of the ways we have succeeded in getting these people is to take the capacity development initiatives to them. Like the parliamentarians, we went to the House of Assembly and we conducted the capacity development there for them. We didn't invite them outside the parliament. And so we discovered that that's also one of the ways to get them to participate, to stay and then participate. And then one other way of getting them is to establish a robust relationship with their leader. So I met with the Speaker of the House of Assembly and then had a lot of time interacting with him, convinced him of the importance of getting the entire House to be part of what we're doing. And when he bought into the idea, he just gave instruction to the other parliamentarians and they were all there to participate. So one of the ways to also get this is to establish the relationship with their leader. Once you get their leader on your side to understand what you're doing, he can literally draft all the members of the parliament into it. So these are some of the strategies that we use. And then, like I also said, apart from these 4 categories of policymakers, the last one, the civil society, civil sector policymakers, I talked about the traditional rulers and the religious leaders. They are also very powerful in Nigeria. And so we have also started engaging them and getting them involved because they command a lot of followership. And so if you have them on your side, it is easy for them to get their followers to also buy into the evidence to policy process, which we are trying to promote. But we have also expanded our policymakers and policy actors base to include the media, to include the uniform services, to include civil society organizations like NGOs and then other bodies. So we have been engaging them, and then we are seeing a lot of results positively.
That's great. Thanks, Jesse. Well, we're almost out of time, but I'll just maybe do one more quick question if you can spare a minute. It was just about the MOU you have with the government and its structure and content. If you could just give us a quick overview of that, that'd be fantastic.
Yes. Well, the MOU followed a lot of diplomatic interactions because that was the first time the university and the Ministry of Health signed an MOU to have a secondment program. So there was a lot of diplomatic interactions and all that. So what happened, because it was short, we had all the secondees still being paid their salaries by their home organization. And then the secondment was not total. It was twice in a week that the secondees would get to the other organization and spend some hours with them and still return. So these were all captured in the MOU. And then, of course, other things captured in the MOU was how to address any issues that will arise from the partnership or from the secondment, which the personnel department of the Ministry of Health and then the Directorate of Research in the university also handled in the among the two. So the best way to do this is just to the two bodies to come into agreement, and then you have units within the two bodies that can now look at the context and then come to some kind of compromise, some kind of agreement on how the secondment can be run. So it just depends on the two organizations. They can just decide what will best work for each organization, and then the partnership and the MOU can be finalized.
Great. So I think that was the last question that we had time for, and I'll just jump in now and thank everyone again for joining today. It was a great conversation. I think that everyone learns a lot from you every time you have an opportunity to present, Jesse. So thanks on behalf of the McMaster Health Forum for spending your time today and allowing us to kind of have a window into your world and all the great stuff that you're doing there. Thank
you, Kaelan. It's a pleasure sharing our experience with all of you guys. Thank you very much.
Great. And thanks for everyone for joining. The slide that's on the screen now will provide you with an overview of how to connect with us if you don't already know. And Steve has already posted the link to where this webinar recording will show up within a week. So we encourage everyone to log onto the website, check out the link, and hopefully share that with others who would like to have been here today but didn't have the opportunity to sign into the webinar. So thanks everyone. On behalf of the McMaster Health Forum, we look forward to working and engaging with all of you in webinars in the Top 10 webinar series in the future going forward. So thanks.